Hi everyone, my name is Sarah DeBiase. I'm an allied health professional lead in an older people's mental health service at Bradford District Care Trust in Yorkshire. And I'm here tonight with my colleagues Hannah, Nima and Steffi, who are my co-falls prevention and bone health officers on the AGILE National Executive Committee. And we're here tonight to demystify for you what it's like to have a role as an officer on an executive committee, to try and entice more of our AGILE members or physiotherapists in general to come and join our professional network and support bringing excellence to the care of older people. It's quite a meaty role, which is why the four of us share it, not least because we sit on 3 large steering groups or advisory groups that interface with across England and or the UK, and they are the National Falls Prevention Coordination Group, the National Order for Inpatient Falls, and the Fracture Liaison Service database. And we're going to let Hannah, Steffi and Nima tell you a little bit more about those roles. And then I'll come back and just let you know how to get in touch if you were interested in either coming and working alongside us and joining us in the Falls and Bone Health role, or interested in any other AGILE committee roles that we have available. Hannah, over to you.
Great, thank you. Hi, so I'm Hannah Barber, and in my day job, I'm in the falls service in Camden in inner London, whilst doing my PhD looking at falls prevention in older adults. So my role within the AGILE committee and Falls and Bone Officer is to sit on the steering group for the National Falls Prevention Coordination Group. I always get those initials mixed up. And this is a group of experts from across the world of falls prevention, looking at how we can do things to influence national policies. We share good practice, and we also develop new resources. So one of those projects that you might have seen, or hopefully you have seen, is the deconditioning resources that have been launched from that group recently. So this is a series of leaflets for both patients and professionals about what we can do about preventing deconditioning, because we know this is obviously a huge issue and a huge risk factor for falls in older adults. So that's my role within the committee. So I'll over to you, Steffi.
Thanks, Hannah. My name's Steffi Bailey, and I'm an advanced clinical practitioner physiotherapist working in an inpatient rehab setting along the south coast of England. My role is to be on the National Audit of Inpatient Falls Advisory Group, and this involves attending quarterly meetings where hip fractures and falls are reviewed from inpatient settings, and projects may evolve from these advisory groups. And one that we've recently been working on is around developing some post-fall guidelines for inpatient settings, which we hope to launch later this year. And these have been developed to help improve outcomes for patients following a fall within inpatient settings within our NHS services. And I'll hand over to Nima.
Hi, I'm Nima Ajit. I work as a joint and bone health physiotherapist in Kingston Public Health. So my role within the Falls AGILE group is to actually kind of lead or be part of Fracture Liaison Service database setting. So again, you might have seen the databases. At the moment, we are reviewing the audition questions, but also we might be getting involved in terms of like producing leaflets or any other projects that come off the Fracture Liaison. So I'm going to pass over to Sarah to conclude.
Thanks, ladies. So we also are currently contributing to the review of the NICE Falls and Older People guidelines, and soon hopefully we'll also contribute to the review of the National Osteoporosis guidelines, which we believe is imminent. We're often invited to be clinical experts for large-scale research studies, and we're currently on a panel for NFIT, which is the National Fame Intervention Trial. So watch this space around that one. We've been working very closely with our colleagues at Later Life Training and BASES, the Professional Network for Exercise Professionals, to develop some collaborative guidelines to support better joint working and integration of physiotherapists and exercise professionals, so that we can offer fidelity and rigorous evidence-based strength and balance programs for people who are at risk of falls, both in the NHS and out into the community. And we also are currently working closely with our colleagues in the Falls Prevention Network to kind of contribute to Falls Awareness Week. And we hope to deliver some AGILE specific topics for our members in that forum. And in that same week is probably when we will launch the post-fall management guidelines that Steffi's talked to. So we really encourage you to keep an eye out for the comms coming out around Falls Awareness Week and join us. So it just leaves us to say, There's plenty of work for everybody, so we are always happy to have more people knock on our door and say they're willing to help. If you're interested and like to know more, you can get in touch with us directly via our email address, which is agile.fallsofficer@gmail.com. So agile.fallsofficer@gmail.com, or you could DM us at AgileCSP on Twitter if that's more comfortable for you, and we can get back in touch that way. We really do get a lot out of this, both personally and professionally, and we do think that physiotherapy knowledge and skills really does feed into these large pieces of work that we've alluded to tonight, and so it really does help from your professional career development, and for no other reason. That's one reason to come and join us and get involved. Anything else you'd like to add, ladies? No? So we are Agile Falls and Bone Health Officers, so we'd love to hear from you. Get in touch. Bye.